Hello, everybody. Welcome to the second episode of the winter season of the Public Health Insider. I'm Casey Farm, Director of Alumni Relations for the College of Public Health and Human Sciences at the Oregon State University Alumni Association.
Hi, everyone. Good evening. I'm Catherine Straubel. I'm Director of Marketing and Communications for the College of Public Health and Human Sciences at Oregon State University. In this episode of the Public Health Insider, we're looking at the multi-generational effects of caregiving and the complex obstacles that caregivers and families face along the way.
Joining us is Karen Hooker, the Joanne Leonard Peterson Endowed Chair in Gerontology and Family Studies and professor in the College of Public Health and Human Sciences. Karen was the founder and inaugural director of the Center for Healthy Aging Research at OSU, and her research interests are in adult development and aging and understanding psychosocial factors related to mental and physical health outcomes. She has also served in leadership roles and as a significant reviewer of scientific information for several professional organizations and has published widely in leading journals. She also has co-authored books in intra-individual variability, mental health, and aging.
Also joining us is Carolyn Mendez-Luck. She's an associate professor of health management and policy in the College of Public Health and Human Sciences. Carolyn's research addresses aging-related health disparities and long-term care in Latinx and other vulnerable adult populations. Her research is community-based, interdisciplinary, and rooted in the principles of health equity. Carolyn was a 2020-2021 Robert Wood Johnson Health Policy Fellow and was placed with the U.S. Senate Special Committee on Aging under Senate Chairman Bob Casey.
Our webcast series is hosted by the OSU Alumni Association in collaboration with the OSU Foundation and the College of Public Health and Human Sciences. Following the panelists' presentation, we'll leave about 25 to 30 minutes for questions and answers. If you look now at the bottom of your screen, you will find a Q&A button, not the chat button, but the Q&A button. You are welcome to type questions throughout the talk in that area, and at the end of the presentation, our panelists will answer as many as they can before the end of the episode.
I think we're about ready. I want to take 1 second to pause real quick and just say that I've wanted to cover this topic for a really long time now. It's a deeply personal topic for those of us in caregiving roles. And if you're a caregiver, I hope that you feel seen and acknowledged. And I also hope that you're getting the care that you need because you are so very, very important. On that note, Karen and Carolyn, would you please turn on your cameras and unmute your mics? The floor is yours.
Hey, good evening, everyone. And thank you, Casey and Catherine, for that really nice introduction. And I just want to also repeat what Catherine just said, and that caregiving is so, so important. In fact, I thought I would start this session with a quote from the former First Lady, Rosalind Carter. Some of you may have heard this before. She said, there are only 4 kinds of people in this world: those who have been caregivers, those who are currently in a caregiving role, those who will be caregivers, and those who will need caregivers. So in other words, caregiving is a topic that really covers everybody. And there are as many different caregiving situations as there are caregivers. Because of that, it's very diverse. Because of that, we want to be able to respond to your specific questions, as every caregiving situation is unique. So Carolyn and I will keep our remarks relatively brief for academics in order to leave ample time for what we hope will be a robust Q&A session at the very end. Next slide, please. Okay, so the need for caregivers really around the world, but in the US in particular, is increasing. Why is that? This graph shows you that the number of remaining years of life expectancy at age 65 has really grown in the last century. We've gained actually several decades of living on average. Researchers talk about the longevity dividend of about 30 years. Now that did dip a bit last year due to the pandemic and the many deaths due to COVID-19, but it will probably keep going up in the future. To quote an AARP commercial, that's a lot of living. The other major factor that explains why societies around the world are becoming increasingly aging societies is that people are having fewer children, at least in developed countries, fewer children than they did a century ago. Now, just getting older doesn't mean you necessarily need care. And in fact, the median age of a caregiver in the US is 62. So already sort of edging up in terms of being considered older. But with increasing age, and especially in your 80s and beyond, there's an increasing chance that you'll be living with a chronic illness, several of which, like severe heart disease, Alzheimer's disease, and many others, do require caregiving. So we know that with aging societies comes a greater need for caregiving. So Carolyn and I thought we would, next slide please, which is actually going to be a brief, it's about a 2-minute video. I wanted just to give you a start with this little caregiving story.
My father-in-law, he used to always, he was very happy to always see you, never when he came in the room. And so he would, he'd always say, "How you doing, girl?" And keep her going, that kind of thing, you know, give you the thumbs up and yeah, so it's one of the, it's a small thing, but you missed it. So some of the challenges that I experience as a caregiver are not always agreeing with family about what needs to be done. So as a daughter-in-law, I do most of the actual caregiving and research and phone calls and doctor's appointments and that kind of thing. Because I work out of my home, my schedule is very flexible, so that does become my role. But I'm also the daughter-in-law, not the daughter, so it's not my primary role to necessarily make the decision about what exactly happens. So that can be challenging because people don't always agree. It's a different role than just being a family member. When you take care of a child, it's sort of expected that you're, taking care of a child because they're not able and they haven't learned life skills yet. When you're taking care of an older person, it feels a little bit different because it's not a role you necessarily expect to take on. When you have a 3-year-old, you expect that you have to potty train and teach them manners and show them how to use a fork and that kind of thing. But with an older person, that's not necessarily an expectation. If I was starting over as a caregiver or just starting out as a caregiver, would be to get as much support as I can in whatever way I can, from other family members, from friends, from support groups, from outside agencies. I think it's all extremely important, and it's not an easy thing to take on. It's very multifaceted, and it's not just your physical time that you're investing or your loss of a little bit of freedom here and there as far as what you like to do and what you can do. It's sometimes it's an unexpected responsibility that you're taking on. You had in your mind where you were going to be at this point in your life, and that's different than what you're actually doing. You've got teenagers, you've got kids to take care of, maybe they're younger, you've got activities that you've got to do. And the person that you're caring for is not always the same person that they used to be.
Okay, thank you. Thanks. Next slide here. So obviously you can't give me feedback at this point about really what you noticed. So I wanted to just highlight some of the stressors in this particular caregiving story. And again, each one is different. Here's really a middle-aged woman. She appears to be, if not the sole caregiver, at least the primary caregiver. And she is likely time-starved due to the many roles that she is currently holding. She's a wife, she's taking care of her in-laws, so that means she has a husband. And I think she must have teenage kids. Her comments at the end there made me think that. Plus, she does have a job. And even though it's a flexible one where she can work from home, she does have a job. So that's a lot to juggle for sure. She talked, and some of the things we like this one because it brings up a lot of the complexities of caregiving. Being a daughter-in-law instead of the daughter does bring up some different types of family dynamics. And there's always family dynamics when you're talking about caregiving, okay? And those can be for good and for bad. She talked about uncertainty. And I think, sometimes people aren't really quite sure when caregiving should start. Should I jump in now into my parents and do that? Or, there's this kind of dance of, should I do it now? Should I wait? So there's uncertainty about when to start caregiving. And for sure, there's uncertainty, lots of uncertainty usually about how and when it will end. In my studies, caregivers have talked about feeling like their own lives are on hold sometimes, which is okay. They're hanging on to get through that period, but it's kind of not okay because a lot of these things can take many, many years to either resolve or the person eventually passing on. And for some types of conditions, for example, a parent maybe, let's say a middle-aged or young old parent caring for an adult child with a mental health problem, it can be sporadic and you kind of never know when you're going to be asked to sort of jump in. And so that on and off again nature of some types of caregiving can be really stressful as well. She also talked about kind of the loss of not being where she thought she would be at this point in her life. I think because of some of the caregiving responsibilities that she had. Now, she didn't talk too much about it, but I wanted to let you know that the research does say that there are potential positive aspects of caregiving as well. Many people talk about feeling like they have the opportunity to give back, especially if you're caring for a parent. Or I've heard this a lot of times with male caregivers, spouse caregivers, who feel like their wives took care of them and their whole families earlier in life, and now it's kind of their turn to do more for her. People talk about, of course you don't feel confident in everything, you got to learn, but you do build feelings of competence around caregiving. It certainly does give your life a purpose. You have a reason to get up in the morning for sure, and there's structure, some structure anyway. And then people also talk about wanting and feeling like good about being a role model for their own, not just teenage children, but maybe even adult children, of being the caregiver. And then I didn't put this on the slide, but in addition to family dynamics sometimes causing, being very fraught, sometimes I've heard people talk about, my siblings and I, we grew up together, but then we're all living in different parts of the country. We don't see each other that often anymore. But then we all sort of came together when we had to for, when dad had his heart attack or when mom was in the hospital. And we made decisions together and we had to work through it. And it brought them actually closer together. So those are some positive aspects of caregiving. Next slide, please. I wanted to get across the point that caregiving really needs to be viewed by all of us as a normal, expectable part of life, not as a kind of unanticipated emergency. In fact, the average middle-aged couple today have more parents between them than children. So think about that. Certainly, therefore, we should expect to be a caregiver if we're in that situation. And the time to begin to prepare is sooner rather than later. It's much, much better to plan in advance. It's easier to have those conversations with family members when both you and your family members see it as kind of in the future, maybe far off, maybe not so far off, but definitely not now. It's easier to have those conversations. Of course, things are going to change depending on the situation and what happens, but it's much easier to adjust some plans that you had previously made rather than having the first conversation with your mom about where she might like to live when she's being just discharged from the hospital after maybe a life-changing health condition, okay? Now, according to the National Alliance for Caregiving, the age group doing the most caregiving right now is actually baby boomers, people aged 57 to 75, and they account for about 34% of current family caregivers. However, and I thought this was interesting, millennials, young adults aged 25 to 40 are not far behind. They're the second most, the group doing the most caregiving, accounting for 23% of caregiving, usually for parents or sometimes grandparents. And they're giving moderate to high intensity care on average about 25 hours per week of care. So definitely not insignificant. So yeah, that's kind of who's giving the care. There's usually a caregiving hierarchy. Research shows that if your spouse is impaired, if there's a living spouse and a spouse who's pretty healthy, the spouse is usually then the primary caregiver. But after the spouse, then it's usually a son or a daughter, most often a daughter, but sons do a lot too. And then after that, it either is children or maybe sometimes grandchildren, siblings, or sometimes even a neighbor, although those tend to be less intense caregiving situations. Let's see, in terms of, I didn't mention this, but technology to age in place is really growing rapidly. And I predict in the next 10 to 20 years, the Internet of Things is going to make things really different in terms of everything being connected, which I think will have some really good payoffs for caregiving into the future. We can maybe talk more about that later. Next slide, please. So anyway, family caregivers definitely need support, okay? So often we hear the term burden associated with caregiving, and I think that's kind of harmful. Certainly, it doesn't make somebody look forward to the caregiving role, and it might actually give them pretty negative views of it, perhaps even unnecessarily. And it certainly is negative for the care recipient. Nobody wants to be a burden. So I try to have people reframe those times as opportunities for growth. Now, for sure, caregiving can put one at risk for depression and social isolation, especially caregiving that's very intense and takes place over perhaps many years. I've heard caregivers talk about feeling like their self is engulfed, like they don't have time for themselves, that caregiving kind of encroaches into all areas of their life. I've heard that. And caregiving stress can also cascade into other areas, such as financial stress. Oh no, how are we going to afford assisted living once we can no longer, care for dad at home or whatever? And also job stress. Oh my goodness, I have to miss work one more time to take mom for these appointments. They're just never ending. So things like that, stress proliferation over time can be damaging, certainly psychologically, but also physically. So we definitely need to be providing more support for families, and there's lots of associations out there that try to do that. Certainly Alzheimer's associations, AARP, there's many others. But I think as a society, we could definitely improve on that point. Next slide, please. And then add to that the fact that for the last almost 2 years now, we've been living in a global pandemic. I think this really can exacerbate stress due to caregiving, and I'd be interested in hearing some examples of that if we have caregivers in the audience. For sure, COVID has adversely affected mental health, and this just is not for caregivers, but really across the board for everybody. Interestingly, if you break it down by age, however, younger adults have reported even more increases in anxiety and depression than older adults. Feelings of isolation have increased. 47% agree that they have felt very lonely during the pandemic. And this is from an APA survey done last year, okay, an American Psychological Association survey on stress in America. And again, looking at the breakdown here by age, it's quite interesting that those who felt most very lonely were the younger adults, and the older adults a little bit less so. But older adults, they have good emotion regulation strategies. They've gone through a lot in their lives already, and so they have maybe in some ways, better coping mechanisms. It's also certainly health behaviors have been affected by COVID-19. 61% of people have said that they've gained weight, and the average amount of weight gained is 15 pounds. So that's not insignificant. Alcohol use has increased 23%, and a large majority, almost over two-thirds of people reported sleep changes, usually getting less sleep, but sometimes getting a lot more sleep than maybe they even need. Next slide, please. So to be a resilient caregiver, obviously we need to deal with stress. The biggest point here that I want to make is that it's super important that as a caregiver, you do take time to care for yourself. At least with Alzheimer's caregiving, the biggest predictor of transition into assisted living or a nursing home isn't how the person with dementia is doing, it's how their caregiver is doing. So to be a better caregiver and to be able to caregive longer, it's really important that you take care of yourself. And a lot of times people will say, I really don't have time, I can't do it. I think increasingly we're thinking about giving even breaks throughout the day. Yes, respite is great, and getting away for maybe longer periods of time is really important. But even on a daily basis, doing micro breaks, I think, is important. And these can be really short, maybe even shorter than 15 to 30 minutes, maybe 5 minutes. I like the idea of an exercise snack. This is like, okay, I don't have time to go for a run right now or go to the gym, but I'm just gonna, I'm gonna do my yoga stretching for the next 5 minutes, or I'm gonna take a brief walk around the yard, just something brief. We all know what we need to do for self-care. Call a friend, watch a funny episode, etc. And then the last thing I have on the list here, I think it's important, is increasingly research is showing that connecting with nature is a big stress reliever. The Japanese started the phrase of forest bathing. It's Shinrin-yoku in Japanese. And it's basically absorbing the sights, sounds, smells, and feel of the forest. And it's found to have a positive impact on well-being. But you don't necessarily have to go to a forest. It's really just being in nature. It can be going to the beach if that's your happy place, or a lake, or a park, or maybe sometimes just looking out the window into, if you've got trees in your yard, doing something like that. Anyway, those are some things we can do. The key is to be in the moment, to really relax, and to try to detach from your stress. So on that note, I'm going to hand the presentation over to Carolyn. Thank you.
Thank you, Karen. So, in some ways, the experience of caregiving is universal, right? So, for example, the amount of time we spend as caregivers and the types of care that we provide, they're often similar across different groups of caregivers or different types of caregivers. But yet in other ways, the caregiving experience is unique to each person. So recognizing the need for support can vary across caregivers. So for example, the circumstances of care or the caregiving situation can trigger a caregiver's realization that he or she needs help. For example, if caregiving is becoming more intensive as time goes on, in terms of like how much time you're spending, or the types of care that you're providing has changed or increased. Is it taking more time from a caregiver's daily life? And so more time and attention is being given to caregiving to the detriment of other responsibilities or hobbies, or finding it harder to cope, even if the situation hasn't changed, but it's harder to cope now than it was before. So all of these could be signs that a caregiver needs support. And it can happen, these triggers can happen at different times along the caregiving journey. One thing also to recognize is that the need of support can be influenced by a caregiver's family and cultural background. So is there an expectation by family members or by the care recipient that care needs to be provided by you, the caregiver? In some families, there are cultural views about caregiving that make it a normal thing to do. So for these caregivers, they may not even recognize that they need help when they actually do, or even feel comfortable asking for help when they do recognize the signs. So these are just two questions that caregivers can ask themselves to evaluate their situations. Next slide, please. So another way caregivers can evaluate their needs, besides asking those kind of questions of themselves, is by taking a caregiver assessment. Sometimes these assessments are done as part of a visit to their healthcare provider, or during the visit that they're taking the person that they're caring for to their healthcare provider. Assessments and clinical visits are becoming more popular and more common, but it really isn't something that is done in every single healthcare setting. So that's something that you would want to ask the next time you go to your doctor, if they do have an assessment that you can take. So in the event that that's not available, caregivers can also take self-assessments by going online and doing a search for caregiver assessments. And so I list 3 here that I found that show that are on different aspects of caregiving, like burden. And again, you know, that's just the word that's used for this particular assessment. There's one on self-care behaviors and also on stress. So there are multiple assessments that a caregiver can take by going online. On average, the assessments might be between 10 and 20 questions and can take maybe 5 to 10 minutes to complete. They usually come with instructions on how to score them and how to understand the results that they got. So having this information is a way to take your temperature, so to speak, as a caregiver, and can be used as a tool to help a caregiver decide whether or not he or she needs more support. So caregivers can take this information that they get from these assessments to their healthcare provider to discuss further, and can help caregivers seek help on their own on the internet. Next slide. So even though it may not feel it at times, and in the caregiving situation, a caregiver might feel alone and doesn't know where to turn for help, there are sources of information and help for them. So I'm just showing here on this slide some main resources, both at the national level and also state and local levels. And there are many more websites that we will post on the college website. For example, there are resources that are for caregivers of persons with dementia or Alzheimer's disease, Parkinson's disease, and cancer. So those are just some examples. There are many more very specific caregiving resources for those types of situations. Some of the resources include developing caregiver skills, support groups, meal and transportation services, and applying for Medicaid services. Your local primary care provider might be a good place to start the conversation on your needs as a caregiver. Some of these healthcare systems have a process in place to connect caregivers to case managers and social services in their local communities. I also want to highlight the Elder Care Locator, which is the second bullet on the left side. It's a federal government resource operated by the Administration for Community Living under the Department of Health and Human Services. You put your zip code in and click on the button, and then a list of aging services is provided for that zip code. It includes your local area agency on aging, or the AAA. So if you haven't heard of that before, the AAA is responsible for providing home and community-based services under the Older Americans Act, which includes meal services, transportation services, legal services, homemaker services, and the Family Caregiver Support Program that also can include respite care. So AAAs operate with federal funding as well as state funding, so the array of services offered in local areas might differ depending on where you live. But it's a great place to start for assessing services for both the caregiver and the person who the caregiver is taking care of. So in Oregon, on the left-hand side, you'll see the Aging and Disability Resource Connection, or the ADRC. That's another good place that can connect you to services. It's meant to be a gateway for services for seniors and for caregivers in Oregon. And then, as I said before, you can check the college website for links to other organizations and services. Next, please. So unfortunately, I want to mention that there are caregiver hotlines available, but unfortunately, there's not a single national caregiver hotline like 911 for caregivers. That just doesn't exist, but there are helplines and hotlines out there. So here are a few that I found, but I'm sure that there are more than what I'm showing here. So the Caregiver Help Desk is run by the Caregiver Action Network. The Veterans Administration has a helpline as well. And that information is there, as you can see. Actually, the VA has a comprehensive caregiver support program, from what I've heard. I have not used those services, but I know several people who have, and they think very highly of the program. And this service is provided to caregivers of military veterans only. So the next is the Alzheimer's Association has a 24-hour, 7-day-a-week helpline, and that's designed for caregivers of people with dementia. So some of these hotlines also provide emotional support in that moment, that care, that you need perhaps to vent or to speak to somebody, as well as information and referral to services. Next slide, please. And so that's all I wanted to say for now. I know that there were some questions that we can talk about that were posed about other resources and things like that. I'm happy to address, but that's it for now. Catherine, and if you want to take it from there.
Yeah, great. Thank you so much. That was a lot of information. That was really good. Wow. Let's see. I don't see any questions in the Q&A, but we had some submitted prior to tonight. So I'll start off with one person is interested in how the landscape in Oregon is compared to other states. Like, are we doing a good job with this, or either one of you want to jump in?
Yeah. So, that is a really big question. I will say a couple of things about this. First, that there is a report from AARP on caregiving in Oregon, and I'm happy to supply that link for you. I can put that in the chat if I'm able to navigate this while I'm talking. But that is a pretty comprehensive view of caregiving in Oregon. I will say that Oregon has one of the lowest nursing home occupancy rates in the country at 66%. In fact, we're tied for the 5th lowest rate. And what that means is that Oregon really provides a range of community-based options for long-term care. So the state has made a commitment well past maybe 3 decades now to home and community-based services, so that people can stay in their homes and receive services rather than being in institutional care like a nursing facility. Mm-hmm. I will say that also Oregon has more adults as a proportion of the state population than the national average. So right now we have just over 18% of our population is adults 65 and older, and that compares to about 16% nationally. So we do have a lot of caregiving going on out there in the state of Oregon. I also want to just say that I think there's a AARP report that indicates we have about 4.1, that's our total population in the state, about 460,000 caregivers in the state, providing 300 million hours of care. And that economic value of that care is $5.9 billion. And that's just in the state of Oregon alone. So I think that there's a lot of need out there. Oregon is one of the leaders in community-based long-term care services. And I will refer you to the report.
Okay.
I would also say that, adult day services, I know people who say this has been a lifesaver for them. It's allowed them to really keep working, to be able to take their loved one to an adult. There's a great one in Corvallis, the Grace Center. But looking around the state, there are several, and the Portland area in particular has quite a few of those. So I would definitely say that would be something to look into. I don't know if we have more or less than other states, but we do have quite a few. The cost, however, in Oregon is relatively high. I think the number I saw was close to $1,900 a month, but I think that must be for full-time adult, like the whole day. I'm not really quite sure. And then there are also some sliding scale, some places that do take sliding scale. So I don't think it would always be that high amount, because that is quite a bit.
I think not only those that are in our audience, but also those who will watch the video, but even for ourselves, we know a lot of people who have been through this, who are going through this. There's, as both of you had talked about, that there's something that we should all kind of prep for ourselves, at some point in time as well. So how can we better support our friends, family, loved ones who are caregivers? I know you kind of talked about some tips and tricks for the caregivers themselves, but for where we are at, how can we better support those individuals?
Well, I love that question, Casey. That's a great question. All of us, if we know someone's in a caregiving role, reach out to them. Don't just say, call me if you need something. Like, say something specific, like, gee, can I bring you dinner? Can I bring your family dinner? Or can I, depending on if you know the care recipient well enough to actually be able to come and do some respite for the primary caregiver, that would be awesome. It depends on your relationships, of course. But yeah, Casey, I think that would be a great takeaway from this session is we could all maybe be reaching out to people who we know are in caregiving roles to offer support.
Yeah, I will just add to that in the research that I've done with caregivers that I've had, I can't tell you how many I've had say to me, I just wish somebody would call me and ask me how I am. And that in of itself means so much in the way of support. Just how are you?
It seems like it's kind of the nice lessons that maybe I would hope that the vast majority of us were taking from the pandemic about like those simple touch points of loved ones, like how much of an impact we know that is probably making for them because it makes for us. We saw that, long list of people who felt lonely or alone in the pandemic, and it was kind of that inverse pyramid, what you might expect. But whether you were at the top or the bottom, I mean, like even at the bottom at 20 or some odd percent, that was still a significant chunk. So it really, the messaging really being those little things can really make a difference in their lives. Catherine, you have another question?
Yeah, we've had a couple of questions around alternative models, different types of community services, whether in Corvallis or elsewhere, just different options that you may have seen that you think are particularly, I don't know, not necessarily particularly innovative unless you've heard of Karen, I think you had one in Portland that you thought was particularly innovative.
I'll talk about that one, but then I also want to get back to talking about, because I saw in the question in the chat that just wanting more information on the types of community services available. Right. But the one I was telling you guys before we all got together here is, I don't know if you've heard of Bridge Meadows it's in North Portland. It's actually nationally, even internationally known. It's a very innovative model where they, it's almost like its own campus. You can Google it and find it. It's fascinating. They have townhomes and then a lot of public spaces, and they put older adults, I think primarily low-income older adults, with and there's parents and foster families there. So parents of foster kids together, and to live there, the older adults have to agree to volunteer a certain amount of hours per week, and it's not a small amount. I think it might be like 10 hours a week. And it's been very successful. I mean, of course, the parents love the extra help they get with their kids. The older adults either, help them with their homework, or there's a beautiful park within easy walking distance. They might go to the park with the kids. And it just is a really successful model. And it's also being replicated. I think there's now one in Redmond, it's called something different, not Bridge Meadows, but it's that same multi-generational living kind of the groups helping each other out. It's not maybe caregiving per se, but it is in a way. Yeah.
Mm-hmm. So some of those other different types of community services or models that are available to people?
Well, just in terms of services, of course, you've got, adult day services, which we covered a little bit, respite services, and Carolyn might know more specifics about exactly which respite services are local, but there are those. In terms of when people do need maybe to move out of a family member's home into other types of care, there are alternatives to just assisted living and to nursing homes, which, as Carolyn said, we don't have a lot of nursing homes because we tend to try to support people in their homes as long as possible. But adult foster care homes, a lot of people find that their loved one kind of likes those better because they're smaller. There are usually maybe 3 to 5 people living there. And it's a very family-like setting. You take your meals, with the family, and you're all together. And so it's just maybe a different feel than most assisted living places are. I think maybe on the order of 50 people living there. I mean, I think anywhere between 30 and then maybe 80. So that has a different feel, which some people might prefer.
I mean, if I can just add to that. So there's also the PACE program, the Program for All-Inclusive Care for the Elderly. It's a small program. There are 144 programs that operate in 30 states in this country. And the program is financed by Medicare and Medicaid. And it's for people who are eligible for those programs and agree to receive services by PACE providers. So there are some limitations around that. There's also you can also pay privately to be in PACE if you don't qualify for Medicare and Medicaid. In Oregon, there are 2 PACE programs. There's one in Grants Pass. It's called All Care PACE. And the other is Providence Elder Place in Portland. And so really the idea behind PACE is to provide all the care that a person needs once they join and become a participant in PACE. They receive all of the care in their home, and then they go to maybe a day setting some days of the week. But PACE will provide this level of service really from the time they start until the time they actually need nursing care. So it's really until the end, for the full life of that person, as long as they're in PACE. So that's another program. It's small, but it's something that is growing across the nation as a model of long-term care within the community. So I just wanted to mention that as well.
Thank you.
Before we get to our next question, I want to read a comment that we have in the Q&A that kind of goes back, Karen and Carolyn, to what we were talking about previously about things that people can do for caregivers in their life. And one of our audience members states that, that they have received support by way of groceries on their front porch, food delivered, walks with, with good people in their lives. And they're very thankful for their friends and family. So it really continues to be some of those little things that we're already seeing, like here in the chat. Let's talk a little bit about long-term care health insurance. I know that neither one of you probably espoused to be insurance experts, and I know it's like a really sticky and tricky place. And if we don't want to go there, that's perfectly fine. I don't want to box you in, but things that you do know about long-term care health insurance would really enjoy hearing about it.
I don't really know that much about it. I mean, I think it has been offered through OSU if you're an employee, and I do know people that have signed up and are in the long-term care program. I think it really boils down to what your own financial situation is. If you're able to maybe think about how long you might be in a nursing home ever, and if you're able to figure you might have that much money saved up, which would be quite a lot. But then also like long-term care, I know people in the past have been worried about getting it because, well, what if that company goes out of business, or what exactly do they cover? I've heard some really positive stories about people being able to tap into their long-term care insurance. But I personally don't know that much about it. So I don't know. Carolyn, do you?
No, I'm afraid I don't. I think you sound like you know more about it than I do, Karen. I really can't speak to that. I'm sorry.
Yeah, but probably somebody, depending on if you're working at your place of work, I would try to talk to somebody who, I'm sure there are people who could talk to you about what are the pros, and then also be aware of some of the cons.
Mm-hmm.
I don't know, price has gone up and down I think a long time ago, it used to be considered a pretty good deal, and then prices shot way up, and I don't know where they are today.
Yeah, maybe perhaps if your workplace, if this is, if you get your insurance through your workplace, talking to your EAP,
Yeah.
could be a good way to go. Well, I appreciate the both of you taking a stab at it.
Yeah.
Catherine, you have another question?
Yeah, a person asked, and it makes me think of, I'm a little bit more familiar with disability community and providing caregivers like in group homes or supported living, that type of situation. This person says that their elderly mother lives in California, has 2 4-hour shifts of caregivers who come into her home every day, but turnover's high. And just like in the disability community, it's really hard to find these jobs. And I'm going to assume, and you can correct me, is it they're typically not the most well-paid positions, but they require so much care and skill as well. And is it hard? Is it hard to are you facing some of those same things in the labor market, I guess, for as far as caregivers?
Yeah, I think every place right now is kind of really looking to hire more people, and certainly elder services, I think, would probably be at the top of that list. If you can find somebody, I think a geriatric social worker is worth their weight in gold, because they have lots of connections to all the places and all the people who might be able to give care. And I know my father lived in Ohio when I was here, and so we worked with a geriatric social worker, and it was very, very helpful towards the end of his life. Yeah,
It's a great idea.
I'll also say that I would suggest tapping into your local, like here in Oregon, the ADRC, the Aging and Disability Resource Connection, because that's a good place to start to look for people to provide that kind of level of care that you need. I will say that last year, spending some time in the Congress and these conversations that I had while I was on the Senate Aging Committee, that there's been a really big concern around the turnover and the low pay for the kind of work that's being done, and how hard it is to find people who are willing to do such hard work for that kind of pay. And then it requires a lot of training. There's a lot of requirements that go on that are involved. And so I know that has been a lot of discussion on Capitol Hill about making changes and having making some laws that actually support direct care workers. And I think that there are some bills in kind of making their way through the legislative process.
And I know the Build Back Better bill is kind of dead, but there were some pretty significant things in that bill that help caregivers.
Yes, but I think that there are others that have sprung up in addition to that are more specific, that are not as big as the Build Back Better plan, but that specifically target direct care workers.
Great.
We are loving the questions that come in from the Q&A. Keep them coming. I have one that came in the registration portal. I'd like to ask the two of you, but yeah, again, keep those coming into the Q&A. It kind of starts off as a comment and then kind of goes into the question, and Karen and Carolyn, that it kind of touches a little bit of some different things that we've already talked about, but it kind of does really address something that I think before the pandemic was an elephant in the room, and certainly it became a lot more publicized, out there. And the individual says the pandemic has not only exacerbated the challenges of caregivers, particularly women who have left the workforce in droves to care for children and other family members without any kind of support. What can we do as employers and as a society to better support and include the valuable contributions of those who have left, particularly women, and what they bring into the workforce? I know it's a heavy question.
Yeah, great question. There's absolutely no doubt that women have left the workforce in droves, and just seeing it happen and realizing, I think people, the pandemic changed everything. I think it made people stop and look at their lives and say, what am I doing? And if they weren't really happy with their job and they could somehow get by without it for a little while anyway, I think a lot of people chose to do that. So how to get them back in? Well, certainly we need better childcare support. Absolutely. I think universal pre-K should be supported. And really just more family support in general would really help women and men, although it does still tend to fall to women, but women and men.
Yeah, I would also say that having flexibility in the workplace, right? I mean, we all learned how to work remotely in these past 2 years. And so I think we should think about keeping some of those flexibilities for parents who need that flexibility, whether it's with childcare or elder care, to be able to work from home if they need to or not. But so I think flexibility, and then I also think, if we really need to take a look at family medical leave. Even though we have it in place as a federal law, I mean, there are ways that we can strengthen it, right? Either make it more generous as employers, or add more protections, keep it longer. I mean, I think that there are other models that we can look at from other countries on how they do that we could support families better.
Yeah, you started to touch on something, and I just want to do a quick follow-up. And Carolyn, you just touched on the very end about like other countries, and maybe this also touches on an area where I don't know about really where the breadth and depth of this particular question will come from for either one of you. But what countries are doing some things that we could really learn from and implement here? Because I know back to the question that we had about as a society, that's pretty broad. So like, what other societies are the two of you seeing that are really doing some things right that maybe we can learn some lessons and implement here in the US?
Oh, well, that's a really big question, isn't it? So
I like these big 35,000-foot questions, Carolyn. What can I say?
I would just say in general, I mean, there are some European countries like, okay, as an example, maybe Sweden, that have models of just, I will say in general, social welfare programs that are designed to help families at different stages, right? Whether you're dealing with children or you're dealing with your parents, that are designed to help like everybody, not just certain groups in their country or certain groups of people. So I think we can learn from those models that actually have social welfare programs that are in place, that are just part of sort of the institution, part of their society, and that those kinds of programs are valued, and they're valued by really supported by taxpayers, right? And so that's just a question of whether that's something that US taxpayers are willing to foot the bill for. So I would say there are many European countries that we could learn from. I don't know if you have something to add to that, Karen.
No, I think that was a good general overview for sure. We don't have the social safety nets that there are in many other countries. And believe me, countries around the world that are aging even more rapidly than us, like Japan, for example, are really, they're struggling too to figure out how to do it all. I think, now this isn't, I still think absolutely the best thing to do would be to support families more through, taxes and so forth. But they're doing a lot with technology, and certain. I think in the future, like I said before, there will be more of that. Even some things that you kind of laugh at when you first see it, but it's like, yeah, that can make someone stay better. Like the pet robots. Like there's something called Pero, which is I think it's a seal, and then there's things like that. For somebody with dementia who used to have a pet and can no longer really handle the responsibilities of that, little things like that can be helpful. But just robots in general, I think, will be much more used. Of course, I think humans always have to be in the loop and be in the equation. We don't want to just, say we're going to take care of it by putting robots everywhere. That's not going to really happen. But there will be ways I think that we can hopefully leverage technology to really help families. Yeah.
So I have a couple of questions that were submitted before registration around technology. So I'm not sure if you'll be aware of them, but I'd like to make sure we address people's questions. One was for those who balance full-time work and caregiving for multiple generations, are there online options for support? The other one was around technology available to keep a person with dementia, or I would say with a disability, intellectual disability, even safe while they're online.
Well, I know, Carolyn, I'll let you talk, but then I'll come back and talk about the safety online a little bit.
Okay, sure. So in terms of like what's available online, right? That there are support groups online. The Family Caregiver Alliance runs an online support group for different types of caregivers. There's the Oregon Family Caregiver Support Program. That again, you can go through the ADRC to find that information, but they have online, I believe that they have online services. The Alzheimer's Association also has links to online support. So like the Oregon Southwest Washington chapter. And I have those websites too that I'm happy to like put in the chat for you. And local counties in Oregon also have links to services like caregiver support programs or caregiver support groups. In terms of respite, that again, I go back to the Family Caregiver Support Program that's funded through Older Americans Act funding, and each state is given monies for this. And so your local AAA would know about the caregiver support programs and whether respite is offered for it, or maybe Powerful Tools for Caregivers is another program that's offered depending on the AAA that you belong to. So I'm happy to put that information in the chat.
So in terms of keeping people safe online, this is really becoming recognized as an issue. In fact, I was just reading today a story about an older man who had quite a bit of resources, but got scammed over a period of many months, and then actually, had to admit to I think it was his son about it. And the son went to the bank, and at that point, there really was nothing they could do. But they said, we need to put programs in place, and some places are doing it. I think banks more and more are, especially with machine learning now and artificial intelligence, they can tell when something is unusual. And we've probably all had it happen when you've been somewhere that you really haven't been before, and suddenly you're getting messages like, did you really make this? Your credit card company's noticing that things are a little bit different. And banks can do that too, and they really should. And if people, especially if it's large sums of money and it seems unusual, they should definitely either contact the person and put it on hold even for a day or two. And they say when banks do that, oftentimes the person then is able to say, oh no, don't take that money out of my account. But I know also, I think banks now are trying to get people who are older to name a family member or someone that they could call if there was ever any concern about money and scams and things like that. So yeah, it's a big issue, and lawyers are dealing with it more and more as well. So yeah.
Great, thank you.
I know we're right at time, but I want to just couple quick more things before we get out, if that's okay with you, Karen and Carolyn, because there's a couple more important questions I really want to address before we get out for the evening. And thank you again for everyone joining us. Really, really appreciate it. As quickly as you can, this is going to be another big question, but again, paring it down. Can you talk a little bit more about the cost of care and impact on families? How and when is Medicaid helpful? Medical bills, debt, things like that. Again, I know those are big questions. That's the first one. And the second one, for both of you, any action items, things that people can do I mean, you've already talked a lot about like kind of different resources. We're going to make sure Catherine and I are going to be able to give people a lot of the resources that you're talking about and more, but other things from an advocacy standpoint, from a volunteerism standpoint. So really those two things to take us out on. I love to hear from both of you.
What do you want to take, Karen?
I was actually going to just put in a plug for those of you who are interested in learning about these types of things. The OSU Gero Conference, it's an annual conference that happens now in its 45th year. It's happening this year, I think so far, still in person on June 3rd. And they have experts talking about all sorts of interesting issues around mostly aging and caregiving and things like that. So I would just mention that. Boy, in terms of funding for long-term care, it's very expensive, and it's expensive to have people come into your home too. But if you don't need it for that many hours, that can be one way that you can try to keep the costs down for at least a little while. But there are assisted living, and in fact, I know for sure in Corvallis there is, because I was on the board of it for a while, that do take Medicaid. So so lower income people can get into the assisted living there. There's usually a waiting list, and not every assisted living does take Medicaid, but some do. And I think there have been a growing number that do. Because yeah, it's really expensive.
So I'll add that I think that there was something in there in the question around Medicare. Mm-hmm. So, unfortunately, Medicare does not provide long-term care services. It does provide post-acute care, such as rehabilitative care, nursing care, after somebody's been in the hospital. Mm-hmm. But there are time limits associated with that, and there are restrictions on that kind of care. So that type of service is not indefinite. There are some Medicare Advantage plans, which are HMOs. So for example, like Kaiser Senior Advantage, they may offer home and community-based services for older adults who would be, but that would be specific to those Medicare Advantage plans. So you would have to do some research to see. And sometimes there are eligibility requirements associated with that as well, like maybe income. I already told you about PACE. And then in terms of Medicaid, well, we know that Medicaid is the biggest payer of long-term care services, right? Because they pay for nursing care, but they also pay for in-home community-based services if you are Medicaid eligible. And that is, we know, is tied to income. And it depends on what state you live in, right? There's more generous benefits, if you will, or coverage, depending on where you live and how much the state funds. So,
where Oregon sits in that span of, are we relatively expensive or not so much, or do you know?
In terms of, I can't answer the question about how expensive we are compared to other states in terms of how much long-term care costs. I don't know that information, but I will say that Oregon as a whole, as a state, is a more generous Medicaid state than other states. So that may not help everybody, but that's my understanding of it. The other thing that I think that you asked, Casey, was what can people do, right? And I would say contact your local officials, your local or your state officials, whether it's your state senator or state congressman, or it's your or your U.S. House of Representatives congressman or U.S. senator. So in this state, we have Senator Wyden and Senator Merkley. Is contact them with your story. Let them know they're there as a service to you. They're your public servant. And so if you have a problem, like let's just say you have a Medicaid application in and it's taking forever and you're wondering what the heck is happening, ask them about that. Senator Wyden is on the Finance Committee, which is over Medicaid and Medicare to some extent. And so that's their jurisdiction. So they want to hear about those things. If you're having problems with a family member in a nursing home, about maybe there's some neglect going on, or just a question that you have about a service that they're providing, contact them, because they'll want to hear what's going on in their state, and they are very moved by personal stories, much more than you might think. So they're there to listen to you. So I would say contact
And
them.
Ron Wyden is a big promoter of aging services. Even as a young senator, he was always very involved in working on behalf of older adults.
Yeah, I think he started his career like with the Gray Panthers.
He
right?
did, yeah.
Carolyn, Karen, thank you very much. Catherine, I think we're ready to wrap things up for this evening.
Yeah, I know. I'm sorry we're out of time. This has been a really, really enlightening conversation. And a huge, huge thank you both to Carolyn and Karen for lending your time, your expertise, and honestly, your heart for this episode, and for all the work that you do to help ensure health and well-being for all people. If you'd like to learn more about the gerontology program, the OSU Center for Healthy Aging Research, you can visit the college website is health.oregonstate.edu, and you can go /healthy.aging to find our aging resources. And yeah.
We also have one more episode in this winter season of the Public Health Insider on Wednesday, March 9th at 5:30 p.m., so in about 3 weeks. For that episode, we'll take a deeper dive at healthful eating and physical activity habits of kids and adolescents, including how educators and families can improve this generation's health and be positive advocates. To register for this upcoming episode and to rewatch and share any episode from the winter season, including tonight's, which will be up in a couple of days, please visit the series site that you can see here on the screen at fororegonstate.org/PHI.
And we also post the videos and a recap on the college's YouTube channel. You can just search by the college name, and on our news site, Synergies, at synergies.oregonstate.edu. So there's lots of ways to see this after the fact.
Lastly, each attendee will receive an email from me tomorrow that will include items like more ways for you to connect with OSU and a brief survey about tonight's event. We would appreciate if you could take a moment to fill it out so we can continue to bring you programming from the college and the Alumni Association that you are interested in. And again, we will also include a link to a comprehensive list of caregiving resources provided by our panelists tonight.
And Casey and I look forward to hosting each of you again for our next episode, which is Wednesday, March 9th at 5:30. Until then, have a really wonderful evening, and thank you.
Thank you.
Thank you, everyone.
Take care.